Thank you, Mr. Mayor. And can I ask, when will your police and crime plan be published?
I'd hope to begin consultation in summer, but can I, Chair, with your permission, email the member to give her more precise dates?
Thank you, and I'll look forward to seeing the draft plan. Now, you've started with a lot of community engagement in your action plan, because you know as well as anyone else that a paper or online consultation simply won't reach widely enough to all the communities in London. So how will Londoners be involved in developing your new police and crime plan?
Chair, I'm really happy to work with the relevant committee, Police and Crime Committee, in relation to talking through the consultation plans we have. And if there's any ideas members have, we're more than happy to take those on board. I suspect, my fingers are crossed, that we'll be out of the pandemic by the time of summer, so we won't have to worry about the health risks. But Chair, can I suggest that my Deputy Mayor for Police and Crime works with members of the Assembly to make sure we have a proper consultation, which is really important for a police and crime plan?
Is that acceptable to you, Assembly Member Russell?
That would be very, very helpful. Yes, and I look forward to hearing about that. Yes, because the important thing is that Londoners are right at the very heart of the plan, and the other thing that's really important is that you're looking at those first principles for policing. So, for example, restoring the original principles of policing by consent. Are you going to be looking at the basic principles of policing in this police and crime plan?
I'm not sure what you mean.
Just right back to the basic
Well,
principles.
The short answer is we're a city of more than 10 million when you include commuters and visitors. With the best will in the world, 33,000 officers by themselves can't keep that city safe without the consent and help of members of the public, and that's why trust and confidence is so important. And one of the things I try to get across, Caroline, is the issue of lack of trust and confidence from black Londoners affects all of us. Because if somebody's a victim of crime today and they don't come forward, the perpetrator could be somebody else. Point Peter made in relation to detection and sanction could commit further crimes going forward. That's why it affects all of us, and that's why it's important for us to, have improved trust and confidence. And you'll have seen the really welcome comments from Deputy Commissioner Steve Howes this week, a year on from George Floyd's brutal murder, about the commitment the police have to improve trust and confidence, and that's integral to how we police by consent.
Thank you. And the other thing that's really important is obviously the public health approach, which you've been speaking about. Now, for example, will you commit to putting violence reduction unit trained Rise Up youth officers in every borough?
I'm not sure if I can give that commitment now. What I'm willing to do is get back to you in relation to we've not written. You're asking me to commit to something in a police and crime plan that's not written yet. But I'm more than happy to take on board any ideas you've got.
If you can have a look at that. They're currently, I believe that there are people in 27 boroughs, but it would be good to have
fund them. We know that, yeah.
In every single borough, so then yes, I think the only other thing I'd like is for you to tell me a bit more about how you plan to put a public health approach into your police and crime plan. Do you have?
So the public health approach is something that's intrinsic and integral to the violence reduction unit work we do. It's also something that needs to be an integral part of the violence against women and girls work we do. Because enforcement is one end of the spectrum, but you've got to deal with a pipeline of young people getting involved in criminality, and also the male perpetrators who are responsible for a vast majority of the violence against women and girls. And the public health approach, which you know as well as anybody else, is about dealing with, the way I describe it to members of the public is, stop the infection occurring in the first place, deal with the infection, stop the infection spreading, using data and a holistic approach. And we've got now some of the world's best data in our city that other cities are envious about. So we can micro-target where we have intervention at an early stage, but also enforcement. And we're particularly keen to use that for the limited resources that police have. It's an operational matter. In answer to the previous question, I mentioned hotspots. I think it's Keith Prince's question. So you will be seeing over the next phase the police targeting their resources in those boroughs where there's a bigger concern around violence against women and girls or against violent crime. But the police and crime plan is quite, at its core, will have a public health approach.
That's really reassuring to hear. Thank you very much.